Good afternoon, everyone. My name is Philippe Guinot. I'm the director of our country program at PASS. PASS is an NGO that was created about 40 years ago by those three guys. I mean, who would have guessed? Three guys, two bikes, and they actually started worrying about the quality of condoms that were available in Asia. Well, in truth, actually, from the beginning, we've been working very closely with an ecosystem of partners, and in particular private sector, because we do believe that working together, we can ensure that people can access the best possible devices, drugs, and vaccines at a price that they can afford. And for that, we work actually around 5 platforms. Our first platform is vaccine. Vaccine is one of the best tool for preventing disease. And for that, we work in partnership with a variety of partners, from WHO to private sector to local authority, to make sure that those vaccines reach people in need. Diagnostics, very often you cannot treat a disease if you don't know what disease you want to treat. Drugs, we do also quite a lot on drug development and innovation. Devices, medical devices, we actually work with partners to identify the best technology, reshape that technology, reinvent that technology to make sure that it's accessible and affordable to the countries where we work. And then finally, health system. Without a functioning health system, it's all in vain. Nothing works if you don't have a healthcare worker that's able to deliver vaccine, drugs, or diagnostics. And I'll just talk a little bit about vaccines in more detail. What you're seeing here is a nurse actually getting ready to vaccinate a kid for Japanese encephalitis. Japanese encephalitis is a disease that kills about 30% of its victims and leaves thousands of them with permanent brain damage. So far, we've been able to develop a drug and get countries to adopt that drug, and we vaccinated over 300 million kids across Asia with that vaccine. Another one I would mention very briefly, in partnership with GSK and WHO, we were the first to launch the Mosquirix, which is the first ever vaccine for malaria. It's not a perfect vaccine, but this is one step forward toward elimination of malaria. Diagnostics. Here what you see is a point-of-care diagnosis for onchocerciasis. And we've decided to focus on 17 neglected disease, and onchocerciasis is the first one. River blindness, we estimate that about 23 million people around the world are suffering from river blindness, and about 125 million are at risk in endemic areas. Before that test was available, the alternative was skin biopsy. And I don't know if any one of you ever had a skin biopsy. It's super painful. And believe me, when we would arrive in villages to do yearly evaluation of the progression of the reduction of the disease, kids would run away very fast from you when they see you arrive. So with that, it's a simple prick at the top of a finger, and you get the results within 15 minutes. We are now in the process of validating a test that will not only test for onchocerciasis, but also for lymphatic filariasis, because the endemic areas are the same. Drugs, and here I'll take just one very simple example. About 400,000 newborn kids die from septicemia. So, and one of the reasons for this is actually the simple fact of cutting the umbilical cord. What we've done is we've actually worked with an antiseptic called chlorhexidine, and we've reformulated that as a gel that can be applied on the cut umbilical cord, and we are now expanding that in 25 countries. What we've seen in the first country where we did the study, in Nepal, is that we were able to reduce neonatal mortality by about 30% simply with this application of a gel for less than 50 cents per patient. The devices, very quickly, contraceptives are extremely important and in demand. So we've developed a contraceptive together with Pfizer, which is called Cyanapress, and this is a subcutaneous contraceptive that can be self-injected by women, giving them yet another opportunity for vaccination. And then finally, system strengthening. We work on advocacy, we work on technical assistance, we work on training. Here what you see is the work we've done with the LGBT community in Vietnam to ensure that people could safely access diagnosis for HIV, but also safely and anonymously, but also accept pre-exposure treatment. And then we've got work where we integrate everything, and this is malaria, and this is really one of our key focus areas, where we've got diagnostic. I've talked about that. We've got drug. We've actually worked with, in partnership with Sanofi, in developing semi-synthetic artemisinin. We've got diagnostics. We are in the process of validating a rapid diagnostic test, which is 100 times more selective and specific than the current ones. And then finally, we are working in several countries around health system strengthening and data visualization to make sure that we're able to track and eliminate malaria from those countries. Thank you very much.